Just remember thinking, this is a full-time job. I have a full-time job. He has a full-time job. What are we going to do? Hey, and welcome to the Supporting Autism Mama podcast, where we don't gatekeep our wins as special needs parents. Today, we're going to talk about something that I know weighs heavy on all of our hearts, the therapy overload. The moment that you get your diagnosis, it almost feels like you need a team of professionals in order to just get through the day. I remember after we got our diagnosis, sitting in the clinic with the amount of paperwork that they hand you and just thinking, how am I going to fit all of this into our schedule? Didn't know how we were going to manage all of these therapies, both working full-time, both in school full-time at that point with 2 children under 3 years old. Just remember thinking, this is a full-time job. I have a full-time job. He has a full-time job. What are we going to do? So, do you really need all of the therapies? If your child is like mine on the day of diagnosis, they told you that they needed 40 hours of ABA a week, speech, OT, feeding therapy, social group, and to get in touch with the early childhood program with your school district. From one mom to another, I know what therapy overload feels like. I already know what it feels like to not know what to do next, not to know what's going to be right for your child, especially if you don't know much about autism, especially if this is a brand new journey for you. It's hard to navigate on your own. It's hard to be able to choose what path to go down, and it's almost suffocating. It feels so overwhelming. So today we're going to discuss a couple hard truths that I learned as a mother with 2 children on the autism spectrum. And one of the hardest truths that I had to accept as a mother is just because it is recommended by professionals doesn't mean it is what is best for your child, for you, and your family. When you're getting your diagnosis, I almost feel like they hand out therapies like every child on the autism spectrum is one size fits all. And if you know anything about the autism spectrum, it is in fact a spectrum. It's not, we have a little bit of autism or we have a lot of autism. It's a spectrum, meaning that every child's sensory sensitivities are going to be different. Every child's speech delay is going to be different. Every child is going to have different difficulties with ADLs. I have 2 children on the autism spectrum. 2 are night and day. I have one child who will literally put everything in his mouth, including non-food items. And then I have another child who will literally throw up every time he brushes his teeth, who only will eat pediatric meal replacement shakes. He eats no other food. He doesn't eat any crackers. He doesn't eat any fruit snacks. He doesn't eat chicken nuggets or pizza. He literally eats meal replacement shakes. His oral sensitivity is so extreme that he only pediatric meal replacement shakes. And this one's oral sensitivity is so extreme that he literally chews on my baseboard. Both have been diagnosed with autism spectrum disorder, both very different. Therapies cannot be one size fits all because there's no 2 children on the autism spectrum that are the same. So something that we had to do as a family was just redefine the process and what that meant, what therapies meant in our home and what place that they held for our children. I think the checklist and the benchmarks start before and then even during your autism diagnosis. You become almost obsessed with milestones and checking off all the milestones. But you have to be careful with this because it's one thing to check your child's progress. It's so easy to get caught up in all of the checklists and all of the benchmarks. Therapy, it's a lot of data. It's a lot of data collection, which I absolutely agree with. I think it's a fantastic way to track your child's progress, which is why I do keep therapy binders, and I think that they've been a huge help for our family. However, something that I have learned through our journey is that sometimes it is necessary for me to redefine how I'm going to recognize their progress. So instead of those checklists and those benchmarks that I have laid out in their therapy binders, it's also important for me to just track some of their other milestones that aren't tracked on paper. My 6-year-old, up until last year, never played with his brother. He has an older brother. I have an 8, a 6, a 2-year-old, and a 7-month-old. My 8 and 6-year-old never played together. They lived together, but they were always played separate. Last summer, they started to play with each other. They started to chase each other in the backyard. And I remember just getting so overwhelmed with joy that I started to cry because that was something that I had never experienced with my children before. And that's not going to be on any checklist or any benchmark that I tried to fill out for my children. But having that connection with their brother is something that I need to remember. It's progress. I think that developing those connections with me and developing that connection with his brother, and now his even 2-year-old brother that he's starting to play with, is something that can't necessarily be tracked on paper, but something that I need to use to redefine his progress. So instead of just checking our checklist and checking my benchmarks, I need to remember the other milestones that we're hitting along the way. The next hard truth that I had to learn as a mother to 2 children on the autism spectrum is to give myself permission. And what do I mean by giving myself permission? I mean, at one point we had 50 plus hours of therapy a week. That is more than a full-time job. That's like you going to work and then working 3 or 4 hours after work. And I think one of the best things that you can do is give yourself permission to do that. You're not failing your children if you just take a small break in therapy, especially if it's something that's going to help your children. Giving yourself the permission to cut back on therapy and take a break in therapy can actually sometimes bring progress for your children. Just allow yourself permission to do that, especially if you think it's what's necessary for your family, because you know best. You know them best. You know your children best. You know your environment best. You know what's going to work best for your family better than any professional. Another thing that I did at this time when we were cutting back on therapy is I made sure that the therapists that we did keep, that they were willing to teach me at home and educate me at home. That allowed my children to actually have therapy more often than what was written down on paper, because I was learning the things that they needed to have full time at home and be able to incorporate those into our everyday life, which is actually a more organic way for them to meet their OT and their speech goals, is to fit it into their everyday life, fit it into our home. If you follow me over on Instagram, you know that we have visual schedules everywhere. We have several different products in our home that help us meet OT and speech goals. And that's because I had therapists that were willing to take the time and educate me. My children would not be able to have cut back on therapy as much as they did if I didn't have therapists that were willing to teach me. And so one of the best things I think that you can do for your children is to not just put them in therapy, but find a therapist that fits right for your family. And you will know the fit when you find it. This episode has resonated with you in any way, if it's helped you to redefine the way that you look at therapies and the fit that they are on their family, please consider sharing this with a friend that might be going through the same thing. Please consider giving it a like. If there's a couple things that you've learned, please consider subscribing to my channel. It does help me and my family. One of my goals with supporting Autism Mama is obviously to help our community and help spread information and to help not gatekeep our wins as special needs parents. One of my personal goals is to be able to leave my bedside nursing job and be able to make content like this for you guys full time. In order to make that possible, hitting that subscribe button, hitting that like button always help me. And the last tip that I just want to give you today is that sometimes you just need to rest. This is a hard pill for parents to swallow, especially mothers sometimes. We always want what's best for your children. You're always trying to make sure that they don't have too much screen time, that they're not eating too much junk, that they're eating all the meals that they need to, that they're getting all their schoolwork done. As a special needs parent, you're also trying to meet all of their OT goals, all of their speech goals, making sure they're hitting those milestones. And the list goes on and on and on. Did we do our sensory diet today so that we're going to be able to settle down for bath time, so we're going to be able to go to bed so that I can get more than 2 hours of sleep at night, right? You're overwhelmed all the time. I am giving you permission to give yourself a break. Cut yourself some slack. And if no one has told you today, you are doing enough. The fact that you even found this podcast and found my channel tells me that you're searching for ways to help better your child, to help better your family's life, and to help find better balance through all of the therapies and all the chaos that sometimes is this autism journey. I just want you to take the time and breathe. Your family deserves rest just as much as they deserve resources. We're always looking for the next best resource. Sometimes the next best resource is just to take a day of rest, a day where you're just together as a family and nothing more. Not together playing in therapy, not together doing schoolwork, not together trying to check off the next milestone, but together just as a family to learn and to grow and to love together. Thank you so much for stopping by. And as always, follow us over on Instagram at ASDMama1017 to get daily updates on our life and insights into our Stay Strong out there.